So here we are. I'm halfway through radiation treatment for recurrent prostate cancer. In this episode, we're going to find out how I'm feeling, what the experience has been like so far, and what I have to expect next. So stay tuned and let's see what's going on.
This podcast deals with prostate cancer, surgery, medication, and other medical topics. The host is a prostate cancer survivor who is recounting his experience with treatment. He is not a medical professional, and you should not use his commentary as medical advice. Please always consult a medical professional when learning about and understanding prostate cancer or any other disease.
So here we are. We are exactly halfway through my 37 radiation doses. And if you've been following my podcast and my journey, I had a recurrence of prostate cancer after about 9 years of surgery. And so I opted to go ahead and have radiation done to kind of finish off the job, if you will. And I'll explain exactly what that process looks like leading up to it, how I made that decision. But mostly, for those of you who have been tuning in and listening, I want you to see what one could expect after about 4 weeks of radiation and how it kind of all began. So just a quick summary. In 2015, in November, I had surgery to have my prostate removed. Leading up to that, I had PSA that was rising. I had a biopsy that was positive. I had both 3+4 and 4.3 Gleason 7 scores. So at the age of 51, it was kind of a consensus between myself and my doctors to have the prostate removed. And I did that. Well, a few years later, about 5 years later, my PSA started to rise again very slowly. And it got to a point where when I hit 0.20, I had to make some decisions about where things were headed. Usually after surgery, if your PSA comes up to 0.2 or 0.20, the doctors tend to concur that that's a biochemical recurrence. And what that really means is that there are some antigens being produced in the bloodstream. And the only thing that really can produce that PSA is prostate or prostate cancer. Since the prostate was removed, the thinking then is that there must be some cancer that is starting to brew again a little bit. It doesn't necessarily mean the cancer has come back full force, but it's the very beginnings. So the thinking is to radiate the area where we think these cells are, and that will pretty much be kind of a part 2 of this treatment journey and put things to rest forever. So I waited until I hit 0.40 because I thought at the time, and it's still possible, even with a rising PSA, it does not always mean a recurrence of prostate cancer. Normally, there are some measures to take to kind of get, I guess, a closer conclusion. One is called a PSMA PET scan. Specifically, the newest one is called PSMA Pylarify. And what this does is this actually it's a PET scan specific to prostate cancer. So if your PSA is rising and you have this test, it may find recurrence, generally in the prostate bed, but it could be spreading at some point. But that's more of an extreme case. And when your PSA is very low, the odds are it is not spreading. It's just starting to brew again a little bit. So I kind of look at them as being seedlings, not quite the plant yet, if that analogy works. So anyway, I waited to see how long it went from 0.2 to 0.4, and it took me about 3 years, which is really slow. But anyway, I had made the decision at 0.4, I was going to start radiation. So in early June, I started visiting the Thompson Proton Center, which is in Knoxville, Tennessee. And I don't know, for those of you that are sports fans, you'll recognize what this is. If you're going to spend any time around Knoxville, you're going to see the Vols, the Volunteers, which is the University of Tennessee, their athletic program. You'll see these shirts, these letters everywhere, but I figured while I'm here for almost 2 months, I might as well kind of fit in with the crowd and participate. So a quick side note, and I talk a lot about proton radiation versus photon radiation. There are basically 2 methods of radiation used for prostate cancer recurrence. Photon radiation, which is also called IMRT, and it's intensified modulation radiotherapy, I think. But anyway, you'll hear IMRT, photon radiation. What they would do is they would shoot a radioactive beam through the body, and just ensure that the field it's covering is a prostate bed and then lymph nodes as well. And it's very successful. A lot of men have gone through it very successfully. The problem is, I shouldn't really call it a problem, but there's an excess effect there in that the radioactive field, the radiation that passes through your body, which are kind of like X-rays, I guess, everything they pass through in the body, they're also radiating. So it's not just the areas of interest, but it's the bone and tissue around it. Generally, not a lot of organs, although there is the bladder, there's the rectum, there's the bowel. And if they're doing lymph nodes, more of that area will be covered by the radiation beam. Proton radiation, which is a much more advanced type of radiation, it actually enters the body, and once it's in the target area, it creates a cloud of radiation that treats the area. But when the radioactive material comes into the body and exits the body, it's at a much lower level of energy, thereby adding additional protection against the areas that are not intending to be radiated. And there's a physicist who invented this principle, and essentially what happens is the beams come in, but they get supercharged at a designated point. So anyway, think of photon treatment as a cloud of radiation within the body that is mainly focused on the areas trying to treat, and the areas around it will be less effective. But anyway, I have read a lot of comments and feedback, both on my YouTube channel, also through Facebook, and even on some of my podcast channels. And it seems from what I am hearing from people that my experience may be a little better than a lot of men are receiving. And what I mean by that is I'm practically 4 months into treatment, and I feel exactly the same way as I did on the first day. I am on Orgovix, which is an ADT similar to Lupron. I have very minimal side effects from the Orgovix. Some hot flashes, very light hot flashes, but pretty much nothing else. I really feel like my normal self. I do sometimes get a little sleepy at the end of the day, but it's not fatigue. It's just I could take a nap, but I get up and sort of work around with that. But I don't know if I'm attributing my good experience to the fact that I am exercising frequently. I'm eating a fairly healthy diet. By the way, my next podcast is going to be about taking care of yourself pre-surgery, pre-radiation, during radiation. And I'm going to talk about exercises for your body. I'm going to talk about food and diet and what to eat. And I think you'll be happy to know that there are more things you can eat that you might think. So I'm going to do a whole podcast just on that, but that'll be my next one. But basically, I've been taking very good care of my body. I'm 60 years old now. I just turned 60. So I think my age maybe contributes a little bit to it. But I think the greatest factor above everything else, or I should say equally to everything else, is my mental state through all of this is to stay very positive and to really understand and acknowledge the fact that there are some things I have control over. There are other things I don't have control over. So I don't have control over what's been happening to my body with respect to prostate cancer. So I don't want to dwell or be sad or really try to wonder why this happened to me and how I could have avoided it. The fact remains this is happening to me, as it will happen to you as well. So if you can train yourself to look to the future in a very positive way, essentially looking towards treatment as being the way to survive this disease and to get past it. And as I said on my last podcast, if you don't treat prostate cancer and it starts getting more aggressive, you will die. It will kill you. You will die of prostate cancer when you don't have to. So treating it early, monitoring it. If there's recurrence, you take the next step. If there's an additional recurrence, you take a next step. You keep the fight up. You keep positive. I think somehow that helps you get through the entire disease and especially the treatments. So maybe that's part of why I've been feeling so good. I'm not my normal self, but I feel 90% of my usual self. And I attribute that to all these things. Also, the fact that when I originally had surgery, I had a very good surgeon. The outcome was as good as can be. now that I'm undergoing radiation treatment, I have one of the best radiation oncologists in the country who started at Loma Linda University in California, which is where they invented proton radiation technology. His name is Dr. Grover, and he's here in Knoxville running the medical program at the Thompson Proton Center. So I've had very good care. I've been very fortunate that my insurance company, which is United Healthcare, they have been just amazing. They have paid for everything. They've paid for my Orgovix, which I believe runs about $4,000 a month just for those pills, and which is crazy to think that a medication that is so essential costs so much money. Proton radiation is often not approved by insurance companies. I think my proton radiation program has a bill of about $350,000, which is staggering. Contrast that to if you were having more traditional IMRT or photon radiation, I think the bill for that is $80,000. If you're watching or you're listening to this from outside of the United States, you're probably falling out of your chair. You know, in my native Canada and certainly around the world, I don't think most citizens would ever pay $300,000-$400,000 to save their lives. So, that's our system here in the U.S. And once again, there's all types of ways to discuss why this is. Anyway, I'm not going to get political on this, but I think it's outrageous that it costs so much. And I've been very fortunate in life with my career and the approach I've taken to leading a good life that I've had the means to buy health insurance through my company that has enabled me to have all these services at zero cost. So that's really amazing. There are many of you out there who won't be as lucky, who maybe cannot get the insurance coverage. I know if you're older and you're on Medicare, Medicare will generally pay for all of this. And so if you're on Medicare, you probably can request proton radiation and it probably will be approved. That's kind of my understanding. But that's just something to kind of work out with all of you. So out of 37 sessions, I just hit the halfway point today. And I if any of you are interested in seeing what the Proton machine looks like, it's real high tech. I'll try to maybe sometime in July, get a few videos of me kind of going in there and seeing the room. The room is something out of science fiction. It's truly amazing. But the preparation, and if any of you are listening or watching to this and you are headed for radiation, I'll give you a few steps that are taken to get you prepared for it, and also what you do every day. I have my sessions in the morning. And so prior to starting radiation, they bring you into the center, they do a CT scan, they create a mold for your body, because when you are getting the radiation, you have to be absolutely still. So they create a mold, they do what's called a simulation, they do a CT scan to kind of look through internally where everything is so that they can plan the program. But on the morning of every radiation, they want to make sure that your bladder is full and that your bowel is empty as much as possible. And what this does, an empty bowel and a full bladder will clear the radiation bed or the prostate bed as much as possible, because we're trying to radiate the prostate bed and not the bladder, and as little as the rectum as possible, and also the bowel. So my ritual, my routine is that I have my breakfast, and then 1 hour. So I eat 2 hours before my session. 1 hour before my session, I pee out as much as I can to empty my bladder. And then I chug 1 liter of water. So it's kind of this, it's something you have to do. And then over the course of the hour, that water will work its way into your bladder. And then when you get to the center before your session, they will use an ultrasonic wand. You've seen them before. You've seen ultrasounds, same thing. It's exactly the same thing. This one's specialized for looking at water, and they'll measure how much water is in your bladder. And they only want to take, you're not going to go into radiation with a full bladder. They want it to be a certain amount full. So they measure how much you have, and by drinking a liter, you will have overdrunk what you need. They will then tell you how much to pee out. They actually give you a cup. They put a line in it and they say, go pee until you hit this line. Then you dump that out and then you're ready to go. You go in, you lay down. The radiation itself, the setup is about 10 minutes to get you in position. They come out with, I think it's an X-ray. I'm not sure what it is, but they come out with some type of beam that just checks that you're in the right position. That goes away. And then the radiation starts. And my radiation, they position the machine in 3 different ways. Each time is about 1 minute, 30 seconds. So basically, 4, 5, 6 minutes is how long the session lasts. And then you're done. And then you go on and you're off for the other day. I am going to, as I mentioned, talk in my next podcast about diet. What do I eat before surgery, like the month leading up to surgery? What do I eat and how do I conduct myself right after surgery? So what's that diet look like? What kind of movement should I be making? This is for surgery. When I had my surgery, I did not have the right diet for myself, and I paid the price for that, and I'll explain that. During radiation, you are not as limited and restricted in what you can eat, but at the same time, you want to try to eat foods that will keep you as regular as possible. But I'll talk more about that, because in the mornings or whenever your session is, when you go in, you want your bowel empty-ish and you want your bladder full. So let me think, is there anything else? Oh yeah. So I mentioned earlier, now that I'm halfway through, about 4 weeks in, just a little under 4 weeks in, I really feel the same. I don't necessarily feel like the radiation has taken its toll in any way. Some of the things that happen sometimes when they're radiating, they are getting a little bit of the bladder, where the bladder meets the prostate bed. You used to have your urethra went through the prostate, and then the prostate was attached to the bladder. Well, the prostate is removed. The bladder is attached to the urethra. So if they're going to radiate the prostate bed, you're going to get a little bit of the bladder. So what happens sometimes is you may feel like you have to pee a little more often. So that's what they call urgency. And so I am usually getting up 3 times at night to pee. And during the day, I notice myself a little more frequency. But at the same time, I'm drinking water. So it's not like if I'm peeing 3 times, it's dribbling. When I go to pee, a good enough of volume comes out. So somehow, maybe, I don't know what the radiation is doing this, but I'm not used to getting up 3 times a night to pee. At the most, it's usually one time a night. You can get a little bit of irritation. And by the way, some of these things I'm mentioning for radiation, this is exactly what will happen whether you have your prostate and you're getting radiation for prostate cancer the first time around or for recurrence. You will sometimes feel a little bit of irritation in the bladder. So those of you that had your prostate removed, if you remember, you had bladder spasms for a few days after surgery, and we remember those well, and we didn't really like them. You don't get bladder spasms, but you get a little bit of that feeling sometimes, very, very light. And there's a very easy cure for that, and that's cranberry juice. And so rather than drink cranberry juice, which has a lot of sugar in it, there are cranberry tablets you take. So if you're getting radiation and you're taking cranberry tablets, you really should have no irritation whatsoever. Other men, and depending on whether your rectum is being protected or not during radiation, what they should be doing in all radiation is they should be putting a balloon into your rectum and inflating it. They inflate it with water. And what this does is, this is different than the Ohr spacer that you might have heard of. When you're having prostate radiation, they can put a spacer between the prostate and the rectum, and that protects the rectum completely. They can't use that spacer when there's no prostate. So instead what they do is they'll put a balloon in the rectum every morning as part of your exercise, and it's not that big of a deal. You got to do what you got to do. But what that does is that widens the rectum, and so it takes part of it out of the field of radiation. So it minimizes the impact of your rectum that is getting radiated. But for some people, the rectum and even a bit of the bowel gets some discomfort. Sometimes some people say there's bleeding. Sometimes it doesn't hold in the fecal material as well. And so you tend to get a lot of diarrhea. So these are all things that I've read about, heard about. None of it has been happening to me. And so I don't know if these are rare exceptions or if I'm kind of like some bizarre, textbook case. I don't know. But I'm having no problems, number one, number two, at all. So, and by this point, by about the fourth week is when you really are kind of in full swing. So we'll see if this changes on the second half of treatment. We'll see what that's all about. So that's enough about me. I want to just talk just very briefly about some ongoing comments that I'm seeing in both YouTube and also Facebook. So I first and foremost, there are many of you, the vast majority of comments that I'm seeing are not only positive, very encouraging. And I want to thank all of you for the amazing words of encouragement. You guys have been just amazing. And so my hope is that I've made an impact in your lives in helping sort of clarify some of the things that aren't really well understood or explained by doctors, maybe taking away some of the mystery. We tend to, with the internet, you tend to hear a lot of negative comments, but you don't always hear about the positive ones. And I think if I had to guess, I would say, the positive outcomes of these procedures, the positive feedback that people give is the vast majority. So I would think most men are having a great experience, but you don't always hear from them. You definitely hear from people with bad experiences. I also have a few people leaving comments that I'm not in the habit of. I don't believe in censorship. I don't believe in removing comments unless they're absolutely inappropriate or unfounded. But, we have this term in the internet called trolls. And when someone trolls, and what that basically means, if you're not aware of it, is when someone comes on just to create trouble, naysayers, people that will automatically negate what you're saying just to, I guess, get a rise out of others. So there are people who have made posts that are contesting a lot of what I've been saying. And so, and a few different ones. If you read through the comments, you'll see them. I will almost always respond to those with the truth, or at least the truth as I understand it. And I want you to realize that a lot of the comments that I have and a lot of the advice that I give, even though I'm not a doctor, and I will always disclaim this and say, I believe a lot of these to be true. But you should always get a real doctor's opinion on any of this. But, I've done a lot of research, and I've met with doctors at Johns Hopkins, and I've met with doctors at the Miami Cancer Institute, as well as other facilities. Every decision I've made with prostate cancer or treatment has been done with consensus of no less than 3 professionals in different hospitals, different areas, nothing to do with one another. I just sort of present my case to each of them and to see what their feedback and what their recommendations are and what their understanding is of this disease. To my surprise, a lot of prostate cancer is still a mystery. So the way doctors form their opinions are based on years and years of research and looking at outcomes. Ironically enough, there's no real science that says removing the prostate with prostate cancer intact, as long as the prostate cancer is within the prostate. There's never actually been science that says that removes the prostate cancer completely. We believe it's the case because it makes sense, but it's never been proven medically or scientifically. It's only been a result of statistics. And so the vast majority of men who have their prostate removed never get prostate cancer again. So, but the proof isn't there. It's just the evidence is. So there's a fine difference there. When it comes to recurrence and radiation treatment and ADTs and all these things, it's the same thing. It's based on observations, but there has never been a science result that says we've definitively proved that if you do A, B will happen. And I think over time with quantum computing and AI, we'll get some more hardcore data that says this is why radiation will eradicate recurrence. And this is why when you remove a prostate and the cancer is completely retained, there's no way it will have gone anywhere else, unless there's a positive margin. But anyway, so I just wanted to say hello. And, once again, go Vols. Not living in Knoxville. I guess for these 2 months, I'm a temporary resident, it seems. So I'm on board with all the local folks here. And I do, like I said, I read every comment. I try to respond as best I can. And I encourage you to keep listening to this podcast. You'll find me on Spotify, on Apple Podcast, on Google Podcast, and then this video will play in YouTube and also in Facebook. My Facebook group is called Mark's Prostate Cancer Experience, which is that's the title of this series in every meeting that you go to. So that's it for today. I thank you all for watching or listening. And as I said, next time we're going to talk about your body and your diet and how maybe that will help you just a little bit as you go through prostate cancer or recurrence. Take care, everybody.